is a candidate for this?
You know, this is a question that we get asked a lot, especially by very thin women, because they've been turned down by 2 or 3 plastic surgeons, and you're too thin, we don't have enough fat. And see, we work on the principles of our liposuction is very, very simple. We don't want to take too much from one specific area. What we want to do is through a large surface area, your entire body, so we go all your abdomen, your back, your arms, your legs, we take a very thin layer in all these. So by having large surface area, and we take a little bit, we leave very little to no contour problems. So women have no issues afterwards. And we get our fat. Even on women that are 100 pounds, we can get fat. So in all reality, I think everybody is a candidate for this procedure. There's very few things. If you're a smoker, it's very difficult to do.
I was just going to say there. I know a few things that might disqualify a patient, and we actually have a list of some of those disqualifiers. So, and you just mentioned smoking, I guess, being kind of number one. And then if either of you could also just kind of explain why these other issues, if you will, would make someone not be a candidate for this type of a procedure, what the danger is.
Well, if they're still under chemotherapy, I think we should wait until chemotherapy is done.
Sure.
That's obvious. The other one is the aspirin. When we inject the fat, we create a channel with a cannula, and we inject fat as the cannula is retracted. But if this channel fills with blood, there's no room for the fat.
Okay.
So you want to make sure they don't bleed. Since we're not cutting open, we have no way to cauterize the bleeder. So you want to make sure. So aspirin, a lot of those supplements cause bleeding. Vitamin E, a lot of they're healthy actually, but they do cause bleeding. And finally, the important one is the understanding of the procedure. The patient has to understand that this is not this. They got to work at it.
Right.
I take pride in the fact that 20% of our patients are nurses or physicians themselves.
Right.
Okay.
Wow.
So they realize that, you know, this is something you work at, because you have to use the expander, you have to get it. And although the flap procedure is considered one stage, it really requires, most people today do some fat grafting after this. They end up having 2-3 operations. But in 2-3 operations with this system, you're really going to get your own breast back, regenerated back inside you. This is a regenerative plastic surgery.